Did you know that type 1 diabetes is an autoimmune disease? If not, don't worry, you're not alone. Many people are unaware of the differences between type 1 and type 2 diabetes. In this video, we will discuss the causes of type 1 diabetes and some of the common symptoms. We will also talk about managing type 1 diabetes and provide some helpful tips for living a healthy life with the condition. Type 1 diabetes is caused by the destruction of insulin-producing cells in the pancreas. The body's immune system attacks and destroys these cells, which results in a complete loss of insulin production. Type 1 diabetes is usually diagnosed in childhood or adolescence, but it can occur at any age. There are a few different symptoms of type 1 diabetes, including 1. Increased thirst. One of the main symptoms of type 1 diabetes is increased thirst. This may seem counterintuitive since diabetics often have high blood sugar levels and, therefore, a decreased hydration level. However, the reason for this feeling of thirst is that people with type 1 diabetes cannot produce or properly use the hormone insulin, which is responsible for regulating blood sugar levels. As a result, excess glucose builds up in the blood and urine and can cause severe dehydration over time. 2. Frequent urination. Type 1 diabetes is a chronic condition that affects how the body handles blood sugar. People with type 1 diabetes can experience various symptoms, including frequent urination. This occurs because the body is unable to properly process glucose, leading to an excess of sugar in the bloodstream. As a result, the body tries to rid itself of the sugar by producing more urine. 3. Extreme fatigue. One of the most common symptoms of type 1 diabetes is fatigue. People with diabetes may feel tired all the time, even after getting a full night's sleep. When sugar can't be used for energy, the body starts to break down fat for fuel, which produces harmful byproducts that can make you feel tired. 4. Blurred vision. Blurred vision is one of the many symptoms of type 1 diabetes. When blood sugar levels are high, the body's fluids become more concentrated, including the fluid in the lens of the eye. This causes the lens to swell and change shape, which leads to blurred vision. 5. Weight loss, despite increased appetite. One of the most common symptoms associated with type 1 diabetes is weight loss, even when a person has an increased appetite. This may occur for a number of reasons, including changes in the way that the body processes and stores nutrients or increased levels of stress or anxiety. If you experience any of these symptoms, it's important to see a doctor right away. Type 1 diabetes is a serious condition that requires lifelong treatment. There is no cure for type 1 diabetes, but it can be managed through a combination of insulin therapy, diet, and exercise. Insulin therapy replaces the insulin that your body is no longer able to produce. It's important to work with a healthcare team to figure out the best insulin regimen for you. Diet is also an important part of managing type 1 diabetes. Eating a healthy diet, including plenty of fruits, vegetables, and whole grains, can help you control your blood sugar levels. Exercise is also beneficial for people with type 1 diabetes. It helps to improve insulin sensitivity and can also help to control weight. If you have type 1 diabetes, it's important to monitor your blood sugar levels carefully. You should check your blood sugar levels before meals and snacks, as well as at bedtime. You may also need to check your blood sugar levels if you experience any symptoms of low blood sugar, such as dizziness or sweating. It's also important to have a plan in place in case of a low blood sugar emergency. You should always carry a source of quick-acting sugar, such as hard candy or glucose tablets, with you in case of an emergency. You should also wear a medical ID bracelet or necklace so that people will know to give you sugar if you are unable to speak. Type 1 diabetes can be a challenge to live with, but it's important to remember that you are not alone. There are many resources available to help you manage your condition. With the right treatment, you can live a long and healthy life. Do you have any questions about type 1 diabetes? Leave a comment below, and we'll do our best to answer them. Thanks for watching this video.